Okay, today is October 26, 2015. My name is Kathleen Harris. I am the examiner. This is Christian Carver. She is the examinee, and she is 22 years old. Okay, so I'm just going to clean the surface. How are you doing, Christian?
I'm doing great. How are you doing?
I'm good. Did you have a good weekend?
I did.
Did you do anything fun?
Not too much fun.
Just relaxed?
Yeah.
Nice. All right, well, we're just going to do an oral facial examination today. So
Okay.
I'm just going to look at the structure and function of your face, your oral cavity, your pharynx, just to see if there's any abnormalities. Okay?
Okay.
All right. So first, I'm just going to look at your face and just the symmetry of your face. I'm going to ask you to sit up straight and just look forward at me. All right. Looks good. No abnormal movements. All right. Okay, now I'm going to look at your jaw and teeth. So I'm going to ask you to open up wide and then close. So, and then close, open and close. And I'm going to touch your face. Open, close. Okay. There's no popping there, no TMJ noises. Range of motion looks good. That's great. Okay, now I'm just going to look at your teeth. Can you give me a big smile? Awesome. Can you open up wide? I'm going to check that you have all your teeth in there. Open up a little wider. Awesome. That's great. Everything looks good. Occlusion is normal. Hygiene is good. All right. Okay, so now we're going to look at your lips. So can you give me a big pucker like this? Can you pucker a little further? Okay. A little reduced motion, but symmetry looks good. Okay, now I'm just going to open this tongue depressor and I'm going to press it against your lips while you're puckering. So just try and push back against the blade. Okay. Okay, there's a little bit of weakness there. All right. Okay, now I'm going to ask you to do ooh, ee for me.
Ooh, ee, ooh, ee.
Okay. Symmetry is good. Okay, now I want you to take a deep breath in and hold air in your cheeks like this. Can you do that for me? Can you try and hold it? Okay, now I'm going to just press on your cheeks a little bit. Hold it one more time. Okay, there's a little bit of weakness. Reduced lip strength, but that's all right. All right. Now I'm going to ask you to do that one more time, and I'm going to just check for nasal emission, okay? So try and hold it as best as you can. You're doing great. Okay. No nasal emission. Okay, so now we're just going to look at your tongue. Okay, so can you open your mouth for me? I'm just going to check the color. All right. Color looks good. No abnormal movement. Size looks good. Can you lift up your tongue? I'm just going to look at your frenum. All right. Looks normal. Okay, now can you protrude your tongue? So just stick your tongue out as far as you can. Awesome. And then retract it. Good. Okay, now I'm going to ask you to stick out your tongue one more time and just press against the tongue blade, okay? Press against. Nice. Strength looks great. Okay. Now I'm going to ask you to put your tongue tip to the right. To the right and to the left. Awesome. And now I'm going to ask you to just apply pressure against the tongue blade, okay? So put your tongue to the right and I'm going to push back. Try and push against me. Awesome. And now to the other side. Push against me. Great. That looks good. On the left it was good. Okay. Now can you put your tongue tip up as high as you can for me? Out of your mouth. Good job. And now down to the bottom. Awesome. Now I'm going to ask you to move your tongue from side to side as fast as you can. So like this. range of motion. Awesome. Okay. Now I'm just going to ask you to open up wide. I'm going to look in the back of your mouth, okay? And put your tongue down just a little bit. Awesome. And now can you tilt your head back? I'm going to look at your hard and soft palate. Color looks great. Got your tonsils in there. Color. The height looks good. No fistulas, no growths. Awesome. Okay. Now finally, I'm going to ask you to open up wide and say ah just for a few seconds. I'm going to look in the very back of your throat at your uvula. Ah. Put your tongue down just a little bit. Nice job, okay? And now I just want you to go ah, 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 ah. Nice job. Everything looks good. No nasality. All right. And that concludes this part of the exam. Thank you so much. Okay, Christian, so for the last thing, we're going to do the Diadochokinetic syllable rates test, which is just to test how fast you can say certain sounds. Okay?
Okay.
So for the first sound, we're going to say puh. So can you say puh for me?
Puh.
Nice. Okay, we're going to say puh as fast as we can, okay? So like this. Puh, 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 puh. Okay?
Mm-hmm.
You got that, or do you want to practice?
I think I have it.
Okay, perfect. All right, and you're just going to do that as fast as you can until I say stop, okay?
Mm-hmm.
All right, ready?
I'm ready.
Set, go. Stop. Awesome. Great job. Okay, now for the next sound, we're going to do tuh, okay?
Mhm.
Can you say tuh for me?
Tuh.
And so we're going to do the exact same thing, so just as fast as you can, tuh, 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 tuh,
Okay.
and I'll tell you when to stop, okay?
Okay.
Ready?
Mm-hmm.
Set, go. Awesome. Great job. Okay. Now for the final one, we're going to do ka. Okay, can you say ka for me?
Ka.
Okay. So the same exact thing as fast as you can, and I'll tell you when to stop.
Okay.
Okay?
Mhm.
Ready? Set, go. Awesome. Great job. Okay. Finally, we're going to put them all together. It's a little more difficult, but we're going to say patika. Okay, so as fast as you can, and I'll tell you when to stop. So you want to say patika for me?
Patika.
Awesome. Okay. Are you ready?
I'm ready.
Okay. 1, 2, 3, go.
Patika, 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 patika.
Awesome. Great job. Okay. And that concludes our exam. Thank you so much, Christian, and we'll get together at a later point to discuss the results.
Okay, thank you.